Well, I think one of the more mature role may be from PARP inhibitor because there's already been one study like the DUE study, which was already been published. And then there's also one ongoing phase 3 trial, the Ruby 2 trial, which we had the poster presentation last year, I think. But the final results was not available yet. To be honest, the combinations of PARP inhibitor together with the immunotherapy, there's some roles in MMR, non-MMR patients, but the hazard ratios, overall speaking, was only around 0.7 in both studies. And there's still no overall survival benefits as such. Then some studies like the DUE study also performed some subgroup analysis trying to look at the combinations of PARP inhibitor together with immunotherapy. And then they try to see whether there's any benefits in any subgroup. And then, for example, for the DUE study, they found that patients with HRR, homologous recombinations repair genes, mutation patients appear to have more benefits from these combinations. And also some patients with like P53 abnormal expression and also serous carcinoma. It seems that the hazard ratios was also better compared to other subgroups. For example, for patients with P53 abnormality, they found that the hazard ratio could be as low as like 0.47. And then for patients with HRR genes mutation, the hazard ratio could be as low as 0.25. So this is some subgroup analysis from the DUE study. For the Ruby 2 trial, obviously, it's still the final results was not available yet. But then from some preliminary data, we could see that for patients with P53 abnormality, the hazard ratio was around 0.3. So it seems that selected group selected group of patients with advanced endometrial cancer with PMR may benefit from this combination. So I think this regimen could warrant further exploration. And then there could be some other novel agent as well. For example, for patients with HER2 mutations or amplification, then there's already some phase 2 trials trying to look at the benefits of Herceptin together with chemotherapy. And then for the phase 2 trial, it could show some benefits in this situation. And currently, there's also some other phase 2-3 trials trying to look at the benefits of adding like targeted therapy at HER2, even at HER3. And also there's some ADC ongoing, like the Destiny Endometrial 01 or the ENGOT-N24, which try to examine the role of pembrolizumab together with some other agents like the TDXD and also carboplatin pembrolizumab and TDXD with rilvegostomig. We try to see which arm will be beneficial in patients with pMMR, HER2 positive, advanced metastatic endometrial cancer.